Hi, you. Yes, you. Did you know that depression is a leading cause of disability worldwide? 1 in 5 people has or will develop a mental problem in their lifetime, and this is specifically in the age brackets 13 to 18 years old. Another fact is that youth depression rates have raised from 5.9 to 8.2 since 2012. How bad is this mental health worldwide? It is serious, and that is why you keep seeing posts like this and videos like this. It shows that the whole world is not doing okay. In this video, I am going to describe what mental health is. I am going to talk about the causes of mental health problems. I will talk about the common mental health disorders. I will talk about preventive measures that can be taken. And then I will talk about things that people can do to stay mentally healthy. And then we are going to explore the treatment options that exist for mentally unhealthy people. Mental health encompasses social well-being, psychological well-being, and emotional well-being. As long as any of these three is interfered with, then you are mentally not okay. So let's dive in to talking about the most common types of mental health disorders. The first one and the leading one is anxiety disorders. Anxiety is excessive fear and worry. The most common types of anxiety disorders is generalized anxiety disorders, social anxiety disorder, and separation anxiety disorder. As time has been going on, people are suffering from social anxiety disorder more than anything. Let me tell you what that means. Social anxiety disorder is the fear of meeting with people. Okay? Separation anxiety disorder is fear of detachment from our loved ones. Generalized anxiety disorder is just as it is. So people nowadays would rather stay alone than mix with people. And you can see the danger of this. Subsequently, this might lead to depression. The second leading mental health disorder is depression. In 2019, 280 million people were living with depression. Amongst the 280 million people, 23 million of them were children. The third leading mental health disorder is PTSD. PTSD is post-traumatic stress disorder. This has been seen mostly in people that have lost their loved ones and in career, related kind of trauma, like people who work in military or people that work in healthcare, especially nurses or doctors. They have also been seen to experience PTSD. There is bipolar disorder. In bipolar disorder, there is bipolar 1 and there is bipolar 2. Bipolar 1 is mania and bipolar 2 is depression. In mania, someone is usually so excited and talkative here and there, and then later on they get into depression where now they are so quiet, they do not want to interact with people. This is actually a mood disorder. The other one is schizophrenia, and this is mostly where people present with hallucinations and delusions and serious agitations. 1 in 300 people has schizophrenia. Examples of schizophrenia is paranoid schizophrenia and disorganized schizophrenia. Paranoid schizophrenia is where people, the patient is usually thinking that somebody is out there to get them, while disorganized schizophrenia can mostly be seen by people that are in the streets collecting all dirt and all form of clothes. These people are mostly unkempt. When you look at them, they are not clean. The other one is eating disorders, and this is where bulimia nervosa and anorexia nervosa comes in. This looks, to the human eye and to people that do not understand what is going on with a person, you're likely to think that it is a small thing. Anorexia nervosa is whereby you don't want to eat food so that you do not grow big. It is a mental problem if you are experiencing that, and it is not funny. It could be fatal in the long run. Bulimia nervosa is where you eat a lot of food, but then you induce vomiting. At this point, I'm going to talk about the causes of mental health problems. Before I go directly to them, I would love to do the classifications. And then if you're a student, after I have listed all the causes, you can try and place these causes into these classifications. There are 4 classifications of the causes to mental health illnesses. The first one is environmental. The second one is physical. The third is genetic. And the fourth is chemical. So let's dive into the causes of mental health problems. The first one is childhood trauma or neglect. Sometimes you might not see this in children, and it might come to manifest later in their lives as adults. So how you treat your kids is very important. The second one is experiencing things like racism. It is not funny to be racist. I don't know why people find it get comfort in being racist. It's not funny, it's not admirable. You're subjecting someone to a lifelong trauma, and they could actually even commit suicide because of it. If you know someone that is racist, or you are that person that is racist, you need to stop doing that. In that line, stigmatization as a form of discrimination is also a cause. So whether you're stigmatizing someone because of their body types or because of a condition that they're suffering from, it is not really okay. Sometimes experiencing abuse or domestic violence as an adult is another cause of mental health problems. Experiencing a severe or long-term form of stress is another thing. So if you're getting stressed because of something continuously, you might need to start talking about it. Being unemployed or being fired from a job can cause you to develop a mental health problem. I usually say that you do not have to work in your line of work. Like what you have studied for, you do not have to do it. So if getting work in your line or in the line of what you've studied for is becoming hard, you can try other things as well. Being homeless or poor housing is another cause. I think I don't know what you think, especially in Kenya there are so many street children. I think the government should come up with a way to have these people somewhere, like being held somewhere, getting food and good clothes and proper shelter. If you're suffering from a chronic illness, you're likely to suffer from depression or even social anxiety. It is very important that, if you know someone that is sick from a chronic illness, do not always show them that they are sick. Sometimes just make them forget that they have been sick. Incorporate them in what you're doing for daily life, so that they forget about they forget about their sicknesses. Being a long-term carer for someone can cause you to develop a mental health problem. This applies to people that take care of people, maybe for kids that were born with a disability, and there are programs that exist to help you not break down mentally because of caring for someone in a long-term way. As we had discussed earlier, people in military are very likely to suffer from a mental health problem, specifically PTSD. It is important to check on those people. If you have a spouse that is in military, give them ample time. These people see very bad things and they experience very bad things in their field. There are physical causes like head injury and epilepsy, and this can cause you to develop a mental health problem. There is family history, especially schizophrenia. It might run in the family, although it's still debatable to some extent. At this point now, I want us to talk about prevention of mental health illness and the potential treatments that are existing for mentally unwell people. Don't go so far away. When preventing mental health problems, we do it in 3 ways, and that is primary prevention, secondary prevention, and tertiary prevention. Primary prevention is aimed at stopping health problems, before they occur. This is done through anti-stigma campaigns and health educating children at a younger age about emotions and mental illnesses. Secondary prevention is aimed at supporting those groups that are at a higher risk of developing a mental health problem, and these groups include the LGBTQIA and those people that are suffering from long-term illnesses, for example hypertension or HIV/AIDS. Tertiary form of prevention is more like a conservative form of approach, and this is used to help those people that have already fallen mentally ill to stay well. This is mostly done through continued therapy. Now, there are treatments that have been seen to work for patients that are fallen mentally ill. The first one is psychotherapy. There are many therapies down there that I'm going to talk about in a minute. There is medication, and there is electroconvulsive therapy. Now let's get to the therapies. The first therapy that I'm going to talk about is psychoanalysis and psychodynamic therapy, and this is aimed at helping you resolve your problems by increasing awareness of your inner world. The other therapy is behavior therapy. This states that a behavior is learned and it can be unlearned, so it helps you shift your attitude towards the bad behaviors so that you can embrace the better behaviors for your mental well-being. This goes hand in hand with cognitive therapy, which helps you become aware of that particular behavior that you need to change. Humanistic therapy helps you free yourself from disabling assumptions so that you live a more fuller life, and also support health. An occupation therapist helps injured, ill, or disabled patients through use of activities of daily living. This could be the mentally ill people or people that have been born with conditions such as autism and birth defects. The other treatment option that exists is medication itself. They are antidepressants, they are anti-anxiety drugs, they are mood stabilizers, amongst other drugs. And the last option is electroconvulsive therapy, and this is done through general anesthesia, whereby electric currents are passed through your brain to intentionally trigger a seizure. This is mostly used in patients that are not responding to medication, and mostly to patients that are suffering from clinical depression in the cases that they are not eating and they have become completely unresponsive to medication. If you have good mental health and you'd love to continue being more mentally well, or you're not mentally well and you want to be mentally okay, there are a few things that I'm going to tell you that you can actually do that are going to help you in that process. First thing is exercise. Remember to exercise. It's super duper important for you. It helps you big time. Eat a balanced diet. Get a good night's sleep. Okay, unless you're a nurse. Yeah. In which case, when you go off, remember to, sleep well. Even if social anxiety is the most common form of anxiety and most of us are suffering from that, please talk to people or to someone if you are going through something. It is important. If you can't talk to people around you, to your family or friends, there are people online that can help you through this. You can look up to Google or Facebook, people that talk about this kind of things online. Take nature walks. For example, I did this talk on a nature walk and I'm feeling really refreshed. I feel so good. It's something that helps me clear my mind every other day. So I would advocate for it. And I've seen more than one person recommending that it is good for your mental health to interact with nature or find something that gets you where you get your spirituality, It's really important. You can go to waterfalls or just a bunch of trees, and that is really helpful, helps you clear your mind. Remember to practice mindfulness. This is the practice whereby you are fully present in what is existing at that moment without having to overthink or being judgy about the whole thing. This is the end of my vlog. Please, if you have not subscribed to this small channel, remember to subscribe. Please give me a thumbs up on this video, and I'm really hoping that I see you in my next vlog. It's getting really cold at this moment, so I really need to go and put on some hoodie or sweater or something to cover up. I don't want to get sick. But please remember to subscribe to my channel, and I'm really truly hopeful that I see you in my next video. Goodbye.